Rachel Stephen-Smith, welcome to Stateline. We might start out today on a very topical matter of the week, being the Jumbunna report into Indigenous overrepresentation in the Territory's justice system. It is, of course, very detailed and very broad. At the broadest level, in your experience, does systemic racism pervade in the operations of the ACT government?
Well, Yuma, Greg, and thank you for having me. And that's certainly what I hear and have heard for many years from Aboriginal and Torres Strait Islander Canberrans, that they experience racism in a way that the rest of us don't necessarily perceive. And certainly in the vast majority of cases, that is not intended. And that is really what systemic racism indicates. It's built into systems and institutions. It's not about individual intention. It's about all of us understanding our Western systems and how they impact on Aboriginal and Torres Strait Islander people. Okay,
so there are many remedies suggested in the report. One, again, at the broadest level, is the idea of an independent systemic racism review in selected agencies, but particularly in justice, obviously. Health is mentioned. Are you open to that? And particularly the independent part of it?
There's already a lot of work going on across government to look at and address systemic racism, so we will obviously continue the conversation with the community about that. And we've also committed to a board of inquiry in relation to the experience of Aboriginal and Torres Strait Islander people, specifically in the AMC and the corrections system.
That sounds a bit non-committal though, around this idea of an independent agency by agency, directorate by directorate review. Are you saying no to that?
No, I think what we're saying is we will continue to talk to the community about how we give effect to these recommendations. What we also hear from community is the last thing they want is more talk, more reviews. There are a lot of recommendations that already exist. How do we implement what we know? And that's the conversation that we'll be having as we work through the 99 recommendations. And as you've indicated, there'll be different approaches needed for different directorates. There are different levels of maturity in terms of the cultural safety of different directorates and different areas within those directorates.
And where does health sit in your view in that scale? If there is a scale, is it beset by or bedevilled by systemic racism to a greater extent than other agencies?
I don't think to a greater extent, and it's something that we're very conscious of. So Canberra Health Services has worked with its consumer reference, Aboriginal and Torres Strait Islander consumer reference group, on its Together Forward strategy. We have made very deliberate steps across both our infrastructure and our services to make Canberra Health Services a safer place for Aboriginal and Torres Strait Islander people through supporting our Aboriginal liaison officers and our Aboriginal staff, but also things like the physical presence of our new Building 5, where immediately Aboriginal and Torres Strait Islander people can see that this is a place where they belong.
And is that matched by presentation and visit numbers from Indigenous Canberrans?
We certainly do see overrepresentation in some areas, but one of the things that I've been pleased about is that we have managed to close the gap in the number of Aboriginal and Torres Strait Islander people, or proportion, who are leaving emergency department before they've received care. That is a really key indicator for the safety of our emergency departments, to ensure that Aboriginal and Torres Strait Islander people are getting care, are feeling safe to stay and receive care at the same rate as others.
All right, it is a big body of work. I'm sure there'll be many more questions on the Jumbunna report and the government's response. Let's move on directly into the health budget now. We are but 1 month into what will be a really critical year of trying to get the health budget back on track, particularly around public hospital services, of course. Have you yet established the root cause of the blowout through the end of last year and the beginning of this year? It was explained at the time that it was because of unexpected presentation numbers. Now, have you established whether that is ongoing, or has that passed?
Well, we hope that there is going to be a plateau, but I think it's going to plateau at that higher level rather than reduce over the next little while. This has been something that all jurisdictions have experienced, and it's a combination of cost escalation and demand increases.
So what gives you confidence that it is plateauing? Are you seeing that already in the numbers?
Oh, no, we're not. We have seen a higher rate of presentation to emergency department this winter as well. But we always see that during winter, which is why we then want to wait for a few months into the financial year to really understand what the pattern is looking like. But we're certainly going to have to be putting measures in place with our staff, with their unions, with consumers and carers to ensure that we can constrain both the growth in service demand, but also the growth in costs across our services.
And what's the next step on those efficiency drives?
Well, we're bringing people together, including in the Health System Council, where we have representatives of our union partners, but also of our universities, of healthcare consumers, of our non-government partners, to work through some of the recommendations around sustainability that we received in the lead up to the budget. So thinking about how we better care for older people who are long staying in hospital and how we successfully discharge them safely from hospital so they're not going to return, how we get care closer into the community and better care for people with chronic illness in the community, how we implement more virtual care solutions so that people are getting that care at home, staying well in the community and not having to come into our acute hospital centres.
What about staffing levels? Are there redundancies to come?
No, we're not looking at redundancies. We've obviously seen a very significant increase in staffing at Canberra Health Services over the last little while. One of the things we've been very focused on is bringing on more permanent staff so we don't need to use as many of the expensive agency and locum staff to meet that increase in demand.
What about in the back office? Because I think the budget papers did flag efficiencies there. Do you rule out administrative and back office function redundancies?
We're certainly not looking at redundancies, but we are looking at ensuring that our back office is as efficient as possible and really focusing on those frontline services. But we also hear from our frontline staff that if they don't have sufficient administration, they're actually going to be less efficient in delivering their services. So it's a real balance, and we'll continue to work with our staff and unions about
All right.
that.
Well, you got a bit of a lesson in the realities of minority government when the Greens came in and crunched back very heavily the proposed special health levy down to $100, and in giving support to that, they've said that they would only guarantee it for 1 year. Is it still the government's intention to have a levy at that amount or any other amount for the subsequent 3 years, 4 years in total?
Yeah, so it is still in our budget considerations that we would continue on that $100 levy for residential properties, but we have agreed with the Greens that we will continue that conversation through this year. I think it is really important to be clear that actually we've got a very mixed response from the Canberra community. Lots of people told us that they understand that everybody needs to make a contribution to the increased costs we're seeing in our health system.
So
and
would you be open to opening a voluntary contribution account if people felt like they wanted to pay $250 and you're making the argument?
I have sometimes thought about whether we could do our tax system that way, but I don't think it'll really work out, in part because there are so many people who have their rates, for example, on an automatic pay system. They won't even look at a box to tick if they had that option. But I think people did send us the message that actually they thought that an additional $5 a week per rateable property was not that much to pay to contribute. It's nowhere near the full impact of the increased cost and demand pressure that we have seen. It's one part of the contribution, but obviously we needed to reach an agreement with the Greens really quickly so that we could get those rate notices out.
Okay.
And it is the reality of minority government.
So would you seek to take it back above $100, whether that be the original $250 or a number between those two amounts in years 2, 3 and 4?
No, I think we've heard really clearly from the Greens political party that they're not going to support that. Now, they've obviously put some ideas on the table around payroll tax, and part of our agreement with them was to add another increment on payroll tax for the largest businesses with national income above $150 million. But there is a limit to how much you can increase that payroll tax on large businesses and not see jobs moving into other jurisdictions. So that's part of the work that we've agreed to do with the Greens over the next little while.
You've also agreed to look at a review for fairer alternative measures What might that include?
Well, that's a very good question. That's why we're going to do the review. One of the things that we discussed with the Greens was that we already have an incredibly progressive rate system. We don't have very many sources of own source revenue in the ACT. So rates, land tax, payroll tax are some of our very limited numbers of taxation sources. And so our rate system already very progressive. In this budget, we have introduced a new amount for rates for properties above $1 million. So we've actually made the rate system even more progressive in this budget. And we talked that through with the Greens, which was one of the reasons that they agreed to the flat $100.
All right, quick final one, Rachel. Permanent staff specialist cardiologists. You've had some departures, resignations, particularly at the North Canberra site in Bruce. How many remain on the payroll at that site in particular?
Well, at the moment, there are some people on leave at North Canberra Hospital. We've got locums filling in, and I want to assure viewers that there is no disruption to services.
Do those locums provide all of the services that the specialist permanent employees did?
Yes, that's right. It's a general cardiology service at North Canberra, so they do. But also the CEO of Canberra Health Services has been talking to the group of cardiologists to understand if there are underlying issues there and to work through with them what a sustainable service looks like and how we can ensure that everybody does feel safe and is able to provide services. We have seen a really significant improvement in performance in terms of the reduction in wait list for cardiology procedures across at Canberra Hospital in particular, but we also know that there have been some ongoing challenges, and the CEO is really leaning in to understand those challenges, get to the bottom of it, work with everyone to see if we can bring those people back who've indicated their resignation.
Right, so bring them back or bring in new employees. Are you hiring for them now?
We'll need to do both, yeah. So we've got some job ads out at the moment. We are recruiting at the moment, but we also want to ensure that we can retain the talent that we've already got and that everybody is feeling safe and like they're delivering quality care to the people of Canberra and the surrounding region.
More than a few challenges as ever in the health portfolio. Rachel Stephen-Smith, thanks for joining us on Stateline.
No worries. Thank you, Greg.